back to our fertility series. In our last episode, we have talked about the most common causes of infertilities in this modern world, including the environmental factors, the physiological factors, and age. We also talk about how the city lives has been negatively impact on fertilities. In this episode, we will talk about traditional Chinese medicine's point of views on how to optimize fertilities. We will also discuss what's the most common hazard to natural fertilities in women and how we can deal with this hazard in our daily lives. Towards the end of the video, we will also share some tips how to enhance natural fertilities and conceptions. I'm Dr. Clara Chan, and I hope you enjoy the video. Before we start, I would like to briefly talk about some basic concepts about traditional Chinese medicine. Traditional Chinese medicine has 1,000 years of history. It believes that our health depends on qi, a vital force of life that surges through the body. Any imbalance to qi can cause disease and illness and affect one's mental, emotional, and spiritual wellness. The imbalance is most commonly caused by an alterations of yin and yang, the two opposite and yet complementary forces in our body. Ancient Chinese believe that each and every structure in our body is an integral and necessary part of the whole. Our body are interconnected with nature and subject to its force. Therefore, changes in nature are always reflected in our body. In order to maintain or regain health, one must achieve the balance between the internal visceral systems and the external elements of earth, fire, water, wood, and metal, which is also referred to as the 5 elements. Unlike Western medicines, which always use a standardized protocol to treat a divine disease or organ, TCM treatments tries to address the individual's biosystem as a whole and seeks to restore the yin-yang balance, the balance of different visceral systems, through treatment specific to that particular individuals. When it comes to fertility, TCM also has its unique point of view. From the traditional Chinese medicine's perspective, kidney is the main organ system governing reproductions and is related to conceptions and pregnancy. It houses congenital accents, which correlated to the number and qualities of egg and sperms. Liver is related to sexual activities as its meridian circulates around the external genitalia. Its functions include regulating the movement of qi, which is also known as life energy, and storing blood, making it the primary organ system involved in a woman's menstrual cycle. Spleen is the organ that is in charge of digesting food, transforming food into nutrients and transporting the nutrients to various parts of your body. It's responsible for generating blood and qi required to maintain healthy reproductive system. Apart from the above organ system, the fertility process also depends on the normal and optimal functions of Chong meridian, which primary functions is regulating the menstruations, and Ren meridian, which is governing the reproductive organs of women and natural conception. As we have mentioned in the prior episode, age plays an important role in a woman's abilities to become pregnant and carrying a pregnancy to term. Based on the TCM theory, natural fertility is governed by the rise and fall of kidney qi and the abundance of innate kidney essence. In Huangdi Neijing, a very old TCM classic manuscript, it has explicitly defined the change of kidney qi in women from birth to menopause into 7 stages, and mentioned how it affects women's growth, development, and fertility. The kidney qi or vital force start exuberating at around age 7 and continue to grow. At around age 14, the menstrual cycle starts indicating that the female could conceive and bear their own child. important. A woman's best reproductive years are in their 20th, when the body is strong and the kidney T is abundant and balanced. From age 28 onward, the kidney T starts to decline and will lower the chance of natural conceptions. Around age 40 to 42, there is a sharp decline in natural conceptions, mainly due to the rapid reductions in egg reserve. According to the original TCM manuscript, the kidney T and other energy-supporting reproductions exhausted by age 49. The average age of menopause is around 50s in our modern world, but most women are unable to have a successful pregnancy, sometimes 5 to 10 years before their menopause. This holds true for natural conceptions as well as conception using fertility assist treatment. Apart from age, there are still other causes that may negatively impact on women's fertility. From the TCM point of view, these main causes could be summarized into 3 areas, namely deficiency syndrome, accumulated coldness, and T stagnations. Detail will be discussed in the following slides. Deficiencies of kidney, liver, and spleen system are most closely related to infertility. Kidney stores the innate axons that govern fertility. The early depletions of the axons could lead to disorders like primary ovarian insufficiency and irregular ovulation. The yang T in the kidney system provide energy for all reproductive related functions and help regulate the menstrual cycles, while kidney yin regulates hormones and blood. Both are essentials to form a healthy uterine lining. Deficiency of spleen and liver system could lead to deficiencies in overall T and blood. These deficiencies could be congenital or acquired due to unhealthy environments and personal habits. Life stress and disease could also induce these deficiencies. Although body constitutions and other innate reasons may cause the coldness in the body, most of the coldness accumulated in the uterus systems is acquired due to personal habits and environmental exposures. Living in cold places, overexposed to air conditioning, or frequent exposures to excessive dampness during menstrual cycle, fond of drinking icy cold drinks could all lead to accumulations of coldness. Cold uterus not only causes the wrong temperatures for the embryo to grow, like a seed growing in cold weather, but also inhibit uterine blood circulations. Liver Qi is largely responsible for the movement of Qi throughout the entire body, and the free flow of blood which nourishes the body. Apart from physical reasons, life stress and emotional imbalance can cause stagnation of Qi in the liver system, while Qi stagnations can also induce emotional imbalances and stress, forming a vicious cycle. Obstructions of liver Qi impeded the free flow of blood in uterus, limiting the lining formations. The obstructions could also lead to blood and flame stasis in the uterus and cause fibroids and cysts. Besides, obstruction of Qi flow in liver meridians could also affect egg developments in the ovaries and block fallopian tubes. It's common knowledge that superfoods like asparagus, avocados, and salmons promote fertility, as they contain healthy fat or essential elements like folic acids. From a TCM point of view, it is also recommendable for women preparing to have a baby to consume more nuts and seeds to boost reproductive energy, fruit and vegetables in black or dark purple colors like figs and blueberry to boost kidney energy, fruit and vegetables in color red like pomegranate or beetroot to enhance blood. Regular intake of a small portions of red meat will also help to improve the blood profile. At the meantime, one should limit or avoid exposures to chemical, heavy metals, antibiotics, hormones in daily food intake. Limit or avoid cold drinks and raw food to prevent coldness from entering into our reproductive system. And spice it up. Warm spices like ginger and cinnamon will help the body to keep its temperature. Healthy lifestyle choices can also help to promote fertility. One should take steps to maintain a healthy weight. Being overweight or significantly underweight can inhibit normal ovulations. It's also important to prevent sexually transmitted infections. Some infections can cause infertility among women. Maintaining a good circadian rhythm and get enough sleep is crucial to maintaining an optimal fertility, as poor sleeping patterns could affect the hormone balance in our body. Among all, manage stress is probably the most important things to do. Stress could affect the natural flow of liver T, which play an important role around the time of conceptions. Keeping the stress at bay could also prevent unnecessary rise of cortisol level, as high cortisol levels for a prolonged period of time may lead to lack of sex drive and irregular menstruations in women. Don't forget to avoid toxin. Quitting smoking, limiting the amount of alcohol intake, curb caffeine, and stay away from environmental toxins such as pesticide, dry cleaning solvent, and lead, as most of the issues that lead to infertilities, like blockage or visceral deficiencies, will also affect the menstruation cycle. Prompt attention to any irregularity happens to menstrual cycle will help to detect and reverse the conditions at an early stage. In the next episode, we will talk more about how Chinese herbal medicine, acupunctures, and other TCM treatments could help to regulate the menstruations and enhance the natural fertilities and conceptions. I'm Dr. Clara Chan, and see you soon.